Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest has not been mentioned, but we will talk about the problem that we see on the CBCT. Specifically, the lower right quadrant where two implants have been placed. This is the sagittal view. On the sagittal view, you can see that the inter-implant distance is approximately 2.8 millimeters. But the problem, however, is the restoration phase. So we will highly advise, because that both the abutments are completely joined together, as it can be seen here on the axial view as well. We will advise either customized abutments for this tooth. Customized abutments can be fabricated by the lab if impression taking at the implant level or the bone level is difficult. So we will advise that the abutments need to be trimmed interdentally between the implants, so that a proper implant impression can be taken. Now this is the transaxial view of the upper right 7. We've got two roots with immense periapical radiolucencies. No sinusitis can be observed in this region. Moving to the upper left 4, first premolar region. Here we can also see that there is a bony defect from where the tooth was extracted. We've got a buccal bone defect. Along with that, we've got approximately 5 millimeters of ridge width with a good 13 millimeters of ridge height. And when we look at the tooth on the lower left second molar, we've got a D1 very opaque radio opaque bone with very little cancellous bone. And here we can see we've got 7 millimeters of ridge width with approximately 9 millimeters of ridge height. So if there are any further questions regarding this case, please feel free to reach to our team. We would be extremely happy to help. This is the upper left canine, which has an endodontic treatment done, and the endodontic treatment seems to be absolutely normal with no periapical radiolucencies or any voids can be observed. The lower right molar on the lower right aspect also has a form of endodontic treatment done, but unfortunately the endodontic treatment has not obturated the mesial canal. This is the distal canal, which seems to be obturated, whereas the mesial has very little to no obturation, and it can be seen on this transaxial view that we don't have any major obturation till the apex, but however we don't have any periapical radiolucencies around this tooth at this point. Thank you very much.